Hi, I'm Dr. Jeff Smith. I want to take a few minutes just to show you quickly what it means to run your preventive care lab test. This is the lab sample on my dog Bella. She's 6 years old and she's going to have her teeth cleaned this month. So we did a quick panel on her, and there's two parts to this lab panel. This is the complete blood count part. So it counts the red blood cells. So it tells us that here's the red blood cell count. The hematocrit is a percentage of red blood cells in the blood. This is the hemoglobin. These are what we call indices that tell us about the hemoglobin and the red blood cells, the concentration of the hemoglobin in the cells, basically how dark red are the red blood cells and how big are the red blood cells. So it tells us how healthy those red blood cells are. Also, we come down to the white blood cells. The neutrophils, lymphocytes, monocytes, eosinophils, basophils, those are all different types of white blood cells. And depending on their proportions in the blood and how they react to each other, we can tell what's normal or what's could be a problem. So you can see over here we have a nice quick reference guide here. This is the normal values all down through here. And we have one that's a little low. Her eosinophil count's a little low. Well, that particular white blood cell is not a big deal for it being low. If it was high, it might concern me she had some parasites or something. And I can look over here and see that when she had her blood panel last year, she was a little bit on the low side too. So that's normal for her. So if we move up to the other half of the blood panel, what we have is the chemistry panel. So we come into focus. So here's her glucose, her creatinine, her BUN. These are all blood chemistry. So this tells us more about her health. The glucose, of course, for diabetic patients. Notice she's at 92. It's very interesting. Last year she was 93, so that's very normal for her. And the BUN and creatinine are kidney tests, and the phosphorus as well is eliminated through the kidney. So that tells us her kidney function is good. Again, she's all in the normal range. We have one little spot here we're getting down to ALT. This is a liver enzyme. So it's a little bit elevated, and it can be elevated for a number of different reasons. It's not a real specific thing. My particular dog, she likes to eat things, and I wouldn't be surprised if she ate something that was a little bit pressure on her liver and it's being processed here. So her alkaline phosphatase, another liver enzyme, GGT, the bilirubin, cholesterol, these things are all normal, so that helps us to not worry so much because we only have one thing that's slightly out. Amylase and lipase are pancreatic values, so we're testing her pancreas. Here's her electrolytes and her calcium. If we look over here, there's some patchy spots. Last year we just did a little mini panel. For young dogs, a lot of times we skip a few tests and we just do a mini panel of what we think is really essential. But this is my dog, and so I decided to go do the full panel on her since she's going under anesthesia. I want to check everything. Sometimes we call it a senior panel, but really it's more of a full comprehensive panel. And we can do either one of those, and you can discuss that with your veterinarian when it's time to come in for a checkup or for pre-anesthetic blood work.